Hello, I'm Cheryl Hawkins. Welcome to Solutions, the show that highlights the incredible work that nonprofits do every day to help solve problems in our communities. On this edition of Solutions, we are taking a closer look at a nonprofit organization that we highlighted in an earlier program. And that organization is NAMI MC, the Montgomery County affiliate of the National Alliance on Mental Illness. NAMI MC's mission is to educate, support, advocate, listen, and lead to improve the lives of people with mental illness and their loved ones. Let's take a look at what NAMI does.
Each year, 1 in 5 U.S. adults experience mental illness, and 17% of youth ages 6 to 17 experience a mental health disorder.
I joined NAMI because I have 2 sons that live with a mental illness, and I didn't want any other families to feel alone like I did.
At NAMI, the first thing we want anyone to know is you are not alone in your mental health journey.
I just really want to talk about so people know that you don't have to go through it alone.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, dedicated to building better lives for the millions of Americans affected by mental illness. We started as 2 moms, gathered around a kitchen table in 1979. And today, we are an alliance of more than 600 local affiliates and 48 state organizations who work in your community to raise awareness, build advocacy, and provide support and education. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. Every year we are expanding, no matter race, religion, age, or sexual identity. We are people with lived experience, families and loved ones, survivors and advocates, and together, we will fight the stigma surrounding mental health and create a better world for the sake of all of us. We have resources for you and can't wait to become an extension of your family. We are here for a healthier world. We are here for better mental health. We are here for each other. Join us.
And now joining me in studio is Sharon Dietsche, Executive Director of NAMI Montgomery County. Sharon, welcome to Solutions.
Hi, Cheryl. Thanks for having me.
Thank you so much for being here. So let's start by talking about NAMI MC's history. When did this local chapter start, and what is its relationship to the national organization?
NAMI Montgomery County started in 1978, and it was literally a group of family members sitting around a table, and they were looking in search of services and support for their loved ones and themselves, for their loved ones with mental illness, and they couldn't find it, so they decided to start something themselves. And so our affiliate actually predates the national office, which is pretty incredible.
Yes.
And so there's a national office, which is located in Arlington, Virginia, and under that is about 48 state organizations, and then under that are 700 affiliates, over 700 affiliates across the country, and NAMI MC is one of those affiliates. We are an alliance, so we are all aligned with the same mission and the same methods of working towards helping families and people with mental illness. Mm-hmm. We all work from a peer-led model, and we all advocate for the reduction of mental health stigma. We are all 501c3s, so we all have our own individual boards and bylaws that we abide to, but the policies and programming are all very similar and aligned within the alliance.
So NAMI Montgomery County started all of this. How did it get to the point that it spread so widely, and then who decided there should be a national headquarters kind of thing?
I think it probably took on a life of its own. And it just shows that there's a need in there. What Montgomery County, what NAMI MC does and what NAMI does across the country is really provide something that traditional mental health treatment does not. When you go to have mental health treatment, it's usually focused on the patient, which is normal, right? But it leaves out a lot of the background and a lot of the support. It can be somewhat isolating isolating sometimes, and family members aren't at the center of the treatment for obvious reasons. And so that's where NAMI comes in to kind of fill those gaps and provide the support in a way that traditional therapy and treatment, mental health treatment cannot. So we're not a replacement for mental health treatment, but we are support so we can envelop the person with the mental health condition and the family in a way that is often left out.
And so what about you? Let's talk about your history a little bit. Do you have a background in working with people with mental illness, or what's your story? How did you come to NAMI?
Well, I'm a licensed clinical social worker, and I've been working to help create healthier families and communities for over 30 years. So I've worked with children, I've worked with families, I've worked with adults, I've worked in different settings such as schools and residential treatment centers, nonprofits, government organizations, outpatient clinics. And so I have a very varied experience in my career, and I'm proud to be a clinical social worker.
That's amazing. For over 30 years, you don't even look like you're 30. So that's awesome. So what was it about NAMI MC that made you want to apply for the position as executive director?
Well, it was, I just believe in that things happen as they should. And when throughout my career, I've worked with NAMI, I've heard of NAMI, I've supported NAMI, and I've also been at the table with NAMI because in other organizations we are very aligned in our mission and our advocacy and our legislative agendas. And so I've known of NAMI having a long legacy and a wonderful reputation, and I wanted to be part of that legacy.
Mm-hmm. And so for some, the term mental illness carries a negative stigma. First, how do you define mental illness and NAMI? What are the symptoms of mental illness, and how can one recognize them?
Yeah, so mental illness is a health condition that's often characterized by a change in mood, emotions, behaviors, and thinking. And it's often also associated with distress. And also some kind of dysfunction or change in relationships, your social relationships, your relationships with work, your relationships with your family or your spouse or your partner, children. And so it's usually something that is happening for some time before somebody might realize it. Sometimes the person doesn't always realize it. Their loved ones might see a difference in them. And mental health is very prevalent. It's 1 in 5 people have a mental health condition. Mm-hmm. 1 in 20 people have a serious mental health illness, and 1 in 6 have a substance use disorder. Okay. So mental health issues are very common, and they're also usually very treatable. Mm-hmm. And so it's something important for people to know that you're not alone, that there's a lot of people who are experiencing the same things.
So is it, you said it's a change in mood. Are these things that happen over a longer period of time? Because the average person can have a change in mood or have some anxiety about a thing just normally. So is it a matter of how long it lasts?
Yes. Yes. So, there's a lot of differences if you take sadness and depression or nervousness and anxiety. And the big difference is that it's pervasive and that it disrupts your functioning over a certain period of time. Mental health professionals are the ones who diagnose mental health conditions, and they use a statistical manual that's produced by the American Psychiatric Association. And there are certain criteria that are given to be able to diagnose. Mm-hmm. So certain things need to happen over a certain period of time, and usually the dysfunction needs to happen in multiple areas of life.
So what are the core services that NAMI provides the public, and do they cost?
The amazing thing about NAMI is that all of our programs are at no cost to the participants. You don't need insurance or anything like that. And so the programs, I like to describe it as 2 tracks of programming. The first track are for people with a mental health condition, and the other track is for family members or loved ones of someone with a mental health condition. We offer support groups for both and classes for both. We also do a lot of mental health awareness around the community in terms of presentations and outreach and events. And that's all to raise awareness around mental health, around our services and programs that are available to the community, and also to reduce stigma of mental health.
And so you have some virtual classes and in-person classes. Does a person, what kind of experience does a person have if they do virtual versus in person?
Yeah, that's a great question. I think after the pandemic, we all know the conveniences of the virtual world, right? And so
got a little spoiled.
Yeah. And so with that, people don't have to commute. They don't have to deal with traffic. They can be in the comfort of their own home. A lot of our participants might have younger children or even family members with a mental health condition who they need to provide care for. And so that all lends to the convenience of being able to do it virtually. But we all know after the pandemic that nothing really takes the place of being in the presence of someone else. And so we do offer some of our programming in person, and that, deeper relationships form faster typically in person situations. And we hear from our participants that most people want to still be virtual, but we work to kind of bookend some of the virtual programming with maybe an in-person meeting at the first session, and then maybe the last session, so that people can have a little bit of both experiences. But there's nothing quite like, talking to somebody during break or walking out to the parking lot together. And so we want to be able to capture both of those experiences for our participants.
So you say you have classes and support groups. What's the difference between a class and a support group?
A great question. So support groups are people coming together to offer support to one another, understanding, share coping skills, and share about their own experiences. And really just provide that connection and support with one another. A place to vent, a place to cry, a place to celebrate your successes and maybe some of the difficult things about your journey and some of the more happy moments of your journey. And classes are more education-based, and so they are evidence-based programs that teach about what it's like to go through a mental health condition, maybe the reasons why this might have happened, or some of the causes of it, or in explaining what somebody might be able to, what somebody might experience through their journey. One of our classes is Family to Family, and that's where family members learn about their loved ones' mental health journey and their condition. And that's one of the classes I hear about all of our programs, but that one really stands out to me because people really get to understand what their loved one's going through and how to best help them. And then they build, even in the classes, they build a support system with the other family members that are going through it, so that even long after they've been a part of our programming, they have each other. And that's really what we want to do, is build a community of support.
Right. So do you have programs for both youth and adults?
We, because it's a peer model, and all of our programming, the thing that makes us very unique is that all of our programming is led by peers with lived experience. So all of our volunteers who facilitate our programs have been there, done that. They've been in the program. They either are somebody with a mental health condition, or they're a loved one or caregiver of someone. So they come with the expertise that maybe practitioners may not have.
And so what kind of training? You say all of the classes are and support groups are led by volunteers. What kind of training do the volunteers have to take or have to do this?
So they are all trained, and the first training they get is lived experience, right? They're coming in with their own experience and their own understanding. So that's key. And then the state organization in Maryland trains them for about 2 days, and what that training consists of mainly is about managing difficult situations, managing crisis situations if something comes up during class or the support group, managing difficult conversations and group dynamics. So they're getting a well-rounded experience in that training. And then we also, NAMI MC also trains them just on the protocols of what we're doing, what to do specifically if there's an emergency or if the Zoom isn't working or whatever might happen. So there's a lot of effort on our end that goes into training our volunteers specifically on the protocols that we have in place.
Great. We're going to take a short break right now, but we're going to come back and talk more with you about what you do. My guest is Sharon Dietsche, Executive Director of NAMI MC. Stay with us. We'll be right back with more solutions.
You may not realize it, but these words, often used to describe someone with a mental health condition, can be very harmful. In a country where 1 in 5 people are affected by a mental health condition, it's time for all of us to step up and change the conversation. Just because someone's struggle isn't obvious on the outside doesn't mean they aren't hurting on the inside. We need to see the person, not the condition. Join with me, pledge to be stigma-free.
Welcome back. You're watching Solutions, the program that highlights the great work of nonprofits in our communities. I'm here with Sharon Dietsche, Executive Director of NAMI Montgomery County, the Montgomery County affiliate of the National Alliance of Mental Illness. So let's talk a little bit about NAMI's staff. How many people work on a full-time basis?
Well, we are a small but mighty team. I am one of 5.
Okay.
And we also, over the past few years, we've had about 9 board members as well, who are also volunteers.
Okay. And the biggest issue for all nonprofits is funds.
Yes.
Let's talk about your fundraising. What's your strategy? Do you have donors, and what kinds of campaigns do you do to raise money?
Yes. Well, as you said, we rely on donations for all of our programming and funding and programming and services. And so we do have a diversified and comprehensive fundraising strategy. We do receive some government grants, some corporate sponsorships, and some government grants and foundation grants. But really, the backbone of our organization are individual donations. Okay. And so a lot of participants donate. We run a few campaigns through the year. In September, we do a suicide prevention awareness appeal. And then towards the end of the year, around Giving Tuesday through the end of the calendar year, we do an appeal. And then we also have our annual walk that usually takes place in May.
Talk more about the walkathon. That's a big event for you all.
Yeah, it's our biggest fundraising event, and it's called NAMI Walks Montgomery County. It's a really fun day. About 400 to 500 people come out. Kids come out. 4-legged pets come out. Lots of fun. We have a DJ. We have sponsor tables. We have a lot of swag, a ribbon cutting. Elected officials are there. Wow. We have Zumba and a raffle. It's a lot of fun. And really, it's a day for the community to come out, for people who are part of our programs and our mission to come out and celebrate and share in the experience of living with a mental health condition, or being an ally, or being a family member, and really just raising our voice and supporting mental health for all. It's a great way to get our name out there and about our program and services, but also to support the community and helping them understand that they're not alone and that we are here to help.
And speaking of that, the community, how how do people know about you? Are they referred to you, or how do they find you?
That's a great question. Well, I think a lot of it is word of mouth, because people are so touched and so inspired by our programming and services that if they've taken something, they talk about it and the word spreads. And that's been a really wonderful aspect of our programming. Also, we do a lot of outreach efforts. And so we do a lot of tabling, we have events, we go to a lot of events, we're out there doing presentations, partnering with other organizations and businesses in the community. So we're out there, we pound the pavement, and really we want everyone to know about NAMI MC and how we can support them if the need is there.
And so how many people do you serve within a year?
Well, typically we've served anywhere from 3,000 to 4,000 people a year.
Wow.
But this past fiscal year, we did something extraordinary where we served over 6,000 people.
Wow.
So it's been a year of tremendous growth, and we're really, really just so pleased with it and really happy about it.
Wow. What does that say about what's happening in the community?
Yeah, it shows that people, one, are more open to understanding about what's going on and receiving the help. And I think that that the need is growing out there. As we know, there's a lot of changes in our community, a lot of changes nationally, and there's a lot of need out there. There's, you know, whenever there's change, there's disruption to people's lives, and we want to be there to support people.
Do you have people who come because they're feeling isolated and they just want to be in the company of other people?
Yes, yeah, absolutely. We, you know, with mental health issues, there's a lot of isolation in them just inherently, and then it can also exacerbate mental health conditions. And so our part of our mission is to create a community that cares. And by building connection and understanding and building a wider community for anyone experiencing a mental health condition, whether personally or through a loved one, it builds that kind of support for them. That's our mission, and that we hope that we can do that for people.
That's great. So NAMI has several helplines or hotlines, one being what you call a warm line. Tell me what's a warm line and why you call it that.
Well, a warm line is different than a hotline.
Right.
And so a hotline is usually something for people in crisis. It's an emergency situation. It's usually staffed by professionals who can manage crisis intervention, and they're usually 24/7. Where a warm line is, it's a non-emergency number, and really our helpline is a resource line. And so people can call in from the community if they're needing help finding resources or need support and information. And we do staff it throughout the day, but if it's the evening or a weekend or a holiday or something, they can leave a message or email to us, and we will respond as soon as we can. And so on your website, I saw that NAMI MC also provides access to other resources and helplines, like one for suicide and other crises for youth and adults, as well as helplines for alcohol and substance abuse, domestic violence, and for veterans in crisis. It seems like you're taking a real holistic approach in trying to help people in some form of a crisis. I think you did mention, but can you say it again? What's the difference between the hotline and the helpline? Yes. The hotline is an emergency-based response. And so it's usually someone who's in a crisis or needing help immediately. And that's usually staffed 24/7. So there's someone there waiting to answer or respond to the call. A warm line is different. It's a non-emergency number, and it's not staffed all the time. It's usually, if somebody does call and there isn't a response right away, they will get back to them as soon as possible. And sometimes it's, I'm looking for this, and then let me get back to you. I'll gather the resources and send them at a later time. Okay. We're learning more about the growing rate of suicides in our communities. What things have NAMI MC put in place to try to combat that? Yeah. Well, I think part of our whole mission is really about supporting the community, and one of those things is suicide prevention. We know that being connected to the community and feeling understood helps suicide prevention efforts. And so our whole mission is about helping support people through those difficult times by providing connection and understanding, information and resources. And so we feel that everything that we do is based in suicide prevention.
You know, I'm just thinking about the period we're living in right now, and it seems like to me every day there's something to really make you feel bad or sad about. What are some things we can do besides just turn off the TV to try to feel better about the state that we're living in right now?
Yeah, I mean, I think there's an interesting balance, and I sure have not found it, about being informed and preserving some of your mental well-being. I think that, you know, when we think about maybe when we were kids, we had to be, to get the information, we had to be in a certain place at a certain time. And now we have all of the information, whether it's good or bad, true or false, in the palm of our hands, accessed every minute of we can access it every minute of the day, and it's coming at us in a way that's incredibly fast.
Yes.
And so it's really about understanding that. I think sometimes we can feel that it's a personal failure if we can't put the phone down or the tablet down, and it's not. It's built to be addictive. And so it's understanding that and working around those parameters, maybe having a cutoff time, or setting the timer on your phone so it's only 5 or 10 minutes or something. Or if you see something upsetting, have something at the ready that you put that down, and then you might do a meditation or think about, you know, your dog or something like that. And so just building in those things to protect yourself, because it's not going away. Handheld devices are here to stay, and the turmoil that we kind of can feel from day to day isn't unfortunately not going to go away anytime soon.
Yeah, and that's interesting that you said those things, that technology is built to be addictive. And that is very true. A lot of people won't talk about that, but it's so very true.
Oh, yes.
So what do you think you'd like your legacy to be with NAMI MC?
Oh, wow. Thank you for asking me that. I would like two things, actually. One is to grow our programs and serve more people in a way that we couldn't have imagined. And I think we're off to a really great start with that. And the second thing is I really want every household in Montgomery County to know about NAMI MC and to know that we're there. You may not need us now, but if you ever do, for people to know that you're not alone and that we're here to help.
Do you have a quick success story that makes you feel warm inside?
You know, when I read the comment cards and the survey results and hear about the impact that we've made on people's lives, every day we share them in the office, and it's just an incredible thing to witness and be part of. And I'm really proud of the team, the staff, and the board. Just the dedication is unbelievable, really.
Thank you so much for being here, Sharon. The work you all are doing is exactly what solutions mean. You're coming up with ways to help people in the community who are struggling with mental illness. Important work.
Thank you so much.
Thank you very much. I'd like to thank my guest, Sharon Dietsche, Executive Director of National Alliance of Mental Illness, Montgomery County, for being on the show and sharing solutions that help improve the lives of people in our communities dealing with mental health illnesses. If you think you need help, you can call the NAMI Montgomery Resource Helpline at 301-949-5852. If you are experiencing a crisis, you can call any of the other numbers listed on the screen. And if you'd like to support the work of NAMI MC, then visit their website at namimc.org or email them at info@namimc.org. I'm Cheryl Hawkins. Thank you for watching, and see you next time for more solutions.